Here, the 5-year-old mare Matilda. She is kept for show jumping. One day, during a routine practice session for a show jumping event, Matilda accidentally banged her head on the obstacle pole. From that unfortunate day, she has been experiencing neurological symptoms like convulsion. Since Matilda is a very precious breeding mare, the owner decided to treat her. Nembutal was prescribed for her condition. Poor Matilda, she was found dead in the paddock. The trainer noticed that she was shivering and her pupils were dilated. She was also found with very shallow breathing and tachycardiac pulse. The only visible lesion found during postmortem was splenomegaly.
This is the pathophysiology of Matilda case. First, it starts when Matilda have head injury. This later on caused lysis of RBC in brain, which lead to the excitotoxicity damage. This later on caused Matilda to suffer from convulsion. And when Matilda is given with Nembutal as the treatment, Matilda will suffer from CNS depression, which lead to death. Nembutal administration as well caused Matilda to suffer from hypoventilation, which caused anoxia and hypoxia and lead to death.
Okay, now I will explain about the mode of action of pentobarbital. So, what is happening when pentobarbital is being administered into the horse? So, what is happening is pentobarbital will actually bind to the beta receptor and open up the GABA receptor. As a result, it will increase the opening of the GABA receptor and increase the chloride ion entering into the postsynaptic neuron and increase the action. And then this will increase the cellular hypopolarization within the central nervous system, and as a result, it will produce close-dependent sedation hypnosis, muscle relaxation, and depression of the sensory cortex and reticular activating system.
Hello guys, today I will be talking about the pharmacokinetics of Nembutal. Nembutal is an anesthetic drug. As you can see here, there are several routes of administration and it depends on the onset of the action. So there are several routes of administration, which is intravenous, oral, rectal and also intravascular, and the most common one will be the intravenous. Next, the distribution. Since it is a highly lipid soluble drug, it will be able to distribute well in the tissues and it will be able to penetrate the blood-brain barrier and even the placental barrier. And the metabolism is basically, it will be metabolized by the liver by the penultimate oxidation. Next, these drugs will be eliminated in the urine and some of the drugs will be eliminated in the feces, and about 25 to 50% of the drug will be eliminated unchanged in the urine.
Okay, so the main use of pentobarbital is to terminate seizures, and also it can be used as sedative and also an anesthetic agent. So the rules of using this drug is to be careful because there are some adverse effects that we don't want, such as the respiratory depression and hypothermia and also some post-anesthetic excitement. Next. So the rules of using these drugs, these are the list of the drugs that cannot be used along with the drugs because there are some of the unwanted effects, but the two main drugs that we should really not use it with are the acetaminophen and also the lidocaine because they cause very fatal effects.
Hello. So what was administered just now was Nembutal, and in the following scene, it has resulted in Matilda's death. Now, let's look at other drugs that can be used as an alternative to treat Matilda's convulsion. One of them, a group of barbiturates, for example, phenobarbital. Now, phenobarbital is a long-acting anticonvulsant. It can also act as an anti-seizures or a sedative agent. Now, what happens when we use phenobarbital upon horses, right, is it depresses the motor centers of the cerebral cortex by impairing chemical transmissions of impulses across synapses in the brain stem. Now, there's also another drug.
Yeah. So the second drug is diazepam. When you use diazepam to the horse, it will hyperpolarize neuron and suppress the neuronal activity by binding to a specific GABA binding site. So diazepam will suppress the presynaptic transmission of seizure activity. So the horse will stop the seizure and it will distribute it widely to the tissues and metabolize extensively. And lastly, if you use in high doses, it will cause muscle weakness, facial and neck muscle fasciculation, ataxia and recumbency. That's all.
Matilda have dilated pupil and also hypothermia.
And she also shown the sign of tachycardia and shallow breathing.
This is a warm blanket. Because Matilda has a hypothermia, warm blanket are being wrapped around her body to conserve the heat. Because of the head trauma, lactate ringers are being given through the jugular vein of Matilda to prevent electrolyte imbalance because lactate ringers have potassium and calcium.
This is the procainamide drug. The drug is the anti-arrhythmic drug and its function to correct the tachycardia of this horse. So I will administer through intravenously, but because we have this fluid, so I will directly put this into the fluid. So next, this is the furosemide drug, and it is a loop diuretic which act on loop of Henle, so it will block the reabsorption of potassium and calcium in the renal tubules, which it will eventually increase the urine output of the horse as well as the Nembutal. So I will also administer this into the fluid.
The possible drug interaction that will exacerbate the condition of the horse is, first is the interaction between the Nembutal and also the opioid. For example, we can take oxycodone and also morphine. The interaction will lead to decrease of opioid efficacy, that giving a relieving pain conditions, and thus it results in causing a withdrawal syndrome.
Next, the interaction between Nembutal and anticonvulsant like valproic acid. Valproic acid will inhibit metabolism of pentobarbital. Thus, it will prolong the action of pentobarbital.
Okay, now I'm going to talk about the interaction between Nembutal and also CNS depressant. For example, is the pentobarbital. This interaction will cause cumulative effect where it will exacerbate the condition of the horse itself. These are the conditions. The first condition is shallow breathing. cause intense sedation. Apart from that, drowsiness. Besides that, impaired cognitive and motor function. And lastly, shivering. And eventually death.